Okay, hi Austin, it's Dr. Buford. We're just getting started on the left knee. We're looking in the medial compartment here. That instrument you see is called a shaver. You can see how it's got those sharp edges. It used to be called a great white shaver because the teeth were like the teeth in a mouth of a great white shark. And it spins around like that and has suction attached to it. So we can use this to flush out the knee as we're looking, and if there's anything that needs to be smoothed out, we can use it for that purpose also. So this is the meniscus underneath the shaver here. You can see where it turns a little bit pink. That's the joint lining or the joint capsule, and then when it turns white, that's the meniscus. So here's the meniscus here. There's what we sometimes refer to as the meniscocapsular junction, and then here's the posterior horn. And so based on your MRI scan and your symptoms, we're going to look here in the posterior horn especially. Just the initial appearance is pretty good. So here's a probe. We're going to look underneath here. And starting from this area, this certainly all looks good. So now this is the root or the far posterior horn of the meniscus. As you get back here and pull, that looks pretty stable. So that's a really good sign. That's one of the things we talked about, that despite your continued symptoms and our best efforts to do everything to get you better, that the meniscus still may not have a tear that needs to be repaired. But it had been long enough that we thought about having this look just to be 100% certain. The articular surface, here's the tibial plateau. This looks pretty good. We can look down a little bit more at it. That looks pretty good. You can see it's a little bit softer in this area compared to on the medial rim. Okay. And then we'll pull back, we'll look at the anterior cruciate ligament. We'll show you that in just a minute. Okay, so we've been using our shaver to remove the ligamentum. You can see the remnant of it. See a little soft tissue here that's cut? It used to attach right here. So there used to be a strand running from here to here. And not the anterior cruciate ligament. The anterior cruciate ligament's back here. Here's a little bit of what's left of the ligamentum, I think. But here's the anterior cruciate ligament running towards the back of the knee here. And it looks good. And now we're going to get over to the lateral compartment in just a minute here. But that ACL looks very good. You had a very thick ligamentum. And now we're going to look in this lateral compartment. Here's our initial look. Here's the lateral meniscus. And right now we're just using the shaver just to irrigate because it has suction, remember. But here's the lateral meniscus. That looks good. There's the meniscocapsular junction. Let's bend the knee up here. Table down, please. Okay, so this is the posterior horn of the lateral meniscus. As we look back here, we can see the popliteus tendon. I'm going to focus a little bit better. So there's the popliteus tendon running up towards 1 o'clock on the screen, behind the meniscus. So that little area where the meniscus looks loose, that's a normal gap in the attachment to the capsule. That's normal because the popliteus tendon runs right there. And then as we get to the posterior horn here, we're getting a really good look here, Austin, and this looks good. Let me take the probe just for a minute. So here's our probe. So again, this posterior horn looks good. You can see the softness of the articular surface here. Okay, so this cartilage is pretty soft here. This is the tibial plateau. The meniscus looks good. And again, there's the popliteus tendon right at the tip of the probe there. Probably the most remarkable thing is as we look at the tibial plateau, you can see how this probe, when we run over the cartilage, it's pretty soft there. Like walking over a trampoline. So, the cartilage on the femoral condyle looks good here. See how it's much firmer here? But down below, you can see how this is a little bit softer. Okay, so next we're going to straighten the knee out and we'll look up at the kneecap or at the patella. This is the patella at the top of the screen. It looks good. Here's the probe coming in. Condylar surface feels pretty good. Here's the trochlea. This is the groove that the patella slides in. And all the way through here, this looks and feels pretty good. All the way over to the lateral facet over here. We'll take the probe out. I'll put the shaver in and we'll just irrigate a little bit. Okay, so I think that's it. I don't see anything else to worry about inside the knee. We'll talk about our strategies for you going forward, especially if we can firm up that articular cartilage a little bit. That may be one of the sources of your symptoms since we don't see any major structural damage to the ligaments or the meniscus. Okay, so good luck to you now. Bye-bye.